it is a cosmetic craze of the century, with men and women scrambling to get a little dose of this, Botox, in order to manage and smooth out their wrinkles. We wanted to get to the bottom of this treatment, so we went straight to the source, a top Manhattan dermatologist, Dr. Michele Green. We sat down to talk about this little cosmetic miracle known as Botox.
Botox is derived from botulism type A, and what it does is it freezes the muscle that actually causes the wrinkle.
Dr. Green addressed the fact that some people think of Botox as a poison.
That's true, but actually what it is it's derived from a pharmaceutical grade where it's purified and it's very safe to use. It's been used for years, actually, for patients who have neurological problems or ophthalmology problems as well.
What are the side effects of Botox?
Well, the only real side effect is that in 1% of patients you can get a slight ptosis or a droop of the eyelid, and it's temporary and it lasts about 2 or 3 weeks. So even though you have the good side effects of Botox lasting several months, you might have a little bit of a droop for 2 or 3 weeks, but it resolves and that's about it.
I asked Dr. Green what she thought about the naysayers about Botox, those who thought that it was not safe.
Botox has been around for many, many years. I don't think people realize that it's been used for neurology patients for 20 years, for patients who had strokes or Bell's palsies or had facial twitches. It's been used for dozens of years for those patients in huge doses in order to have those patients find relief. So the cosmetic uses, even though we've been using them for about a dozen years now, are very small in comparison to the doses that have been used for neurology patients for years, and it's very safe.
The one bit of advice that Dr. Green advises is know who is administering your Botox.
It's not like you can just inject it into someone's forehead without understanding the different areas and different muscles in the forehead and in the glabella area, which is the area between your eyes. It's the procerus muscle, which is different from the frontalis muscle, which is above it. And people who don't understand the architecture of the face are injecting it haphazardly and don't understand that's what causes droops and that's what causes people to look uneven or to look like they've had too much Botox.
And it's not just the women who are getting this famous shot.
More men than women are just starting now to be concerned and coming in and saying that their wife got Botox or their girlfriend's getting Botox, and they're interested in looking better and looking younger.
So if you have a wrinkle or two that you want to iron out, well, Botox be your solution.